One of the most common misconceptions about iron deficiency is that it's just a minor issue that causes a bit of fatigue. But did you know that iron deficiency is actually the most prevalent nutritional disorder in the world? In fact, if left untreated, it can lead to severe complications, including impaired cognitive function, decreased immunity, and even heart problems. Many people don't realize that the symptoms of iron deficiency often overlap with those of anemia, making it difficult to identify the real problem. This confusion can prevent people from getting the proper treatment they need, worsening their health over time. I am V, and in today's video, we're going to break down the differences between iron deficiency and anemia, two conditions that are often mistaken for each other. We'll cover the causes, symptoms, and how to distinguish between them so you can better understand your health and take the right steps towards effective treatment. This video will provide you with all the information you need to spot the signs early and get the appropriate care. So, make sure to watch this video to the end, hit the like and subscribe button, and do not forget to share with your friends and family. What is iron deficiency? Iron deficiency occurs when your body doesn't have enough iron to produce adequate amounts of hemoglobin, the protein in red blood cells that is crucial for carrying oxygen throughout the body. Iron is not just important for transporting oxygen, it's also vital for energy production, cognitive development, and a robust immune system. Without sufficient iron, your body can't function optimally, leading to a range of health issues that can significantly impact your daily life. What is anemia? On the other hand, anemia is a broader term used to describe a condition where there is a deficiency in the number or quality of red blood cells or hemoglobin in your blood. This deficiency can result from various causes, not just iron deficiency. For instance, anemia can also be caused by a lack of other essential nutrients like vitamin B12 or folate, chronic diseases such as kidney disease, or genetic conditions like sickle cell anemia. Essentially, while all iron deficiency anemia is a form of anemia, not all anemia is caused by iron deficiency. Key differences between iron deficiency and anemia. So, what's the key difference between iron deficiency and anemia? Iron deficiency refers specifically to a shortage of iron in the body, which can lead to iron deficiency anemia if it's severe enough. Anemia, however, is a broader condition that results when your body doesn't have enough red blood cells or hemoglobin, regardless of the cause. Understanding this distinction is crucial because the treatment for anemia depends on its underlying cause. For example, if anemia is due to a vitamin B12 deficiency, increasing iron intake won't help. It's essential to identify the root cause to get the correct treatment. Causes of iron deficiency. Iron deficiency can develop for several reasons, and understanding these causes is crucial for both prevention and treatment. One of the most common causes is inadequate dietary intake. This is particularly true for individuals who follow vegetarian or vegan diets, as plant-based sources of iron, non-heme iron, are not as easily absorbed by the body as iron from animal sources, heme iron. Another significant cause is increased iron needs. For example, pregnant women require more iron to support the growing fetus and increased blood volume, making them more susceptible to iron deficiency. Additionally, chronic blood loss is a major factor. This could be due to heavy menstrual periods, which can deplete iron stores over time, or gastrointestinal bleeding, often caused by conditions such as ulcers, hemorrhoids, or even cancer. Finally, certain medical conditions can impair iron absorption, such as celiac disease, Crohn's disease, or after a gastric bypass surgery. In these cases, the body cannot absorb iron efficiently, even if the diet is sufficient in iron. Symptoms of iron deficiency. Iron deficiency can manifest with a variety of symptoms, which often develop gradually as the body's iron stores are depleted. The most common symptoms include persistent fatigue and weakness, as your muscles and tissues aren't getting enough oxygen to function properly. You might also experience shortness of breath during routine activities, even something as simple as climbing a flight of stairs, because your body is struggling to distribute oxygen efficiently. Other symptoms can include dizziness or lightheadedness, particularly when standing up quickly, as well as headaches due to low oxygen levels reaching the brain. There are also less obvious symptoms to be aware of. You might notice that your skin appears paler than usual, or that you have brittle nails and hair loss, as iron is essential for maintaining healthy skin, hair, and nails. Some people with iron deficiency also develop pica, a condition characterized by cravings for non-nutritive substances like ice, dirt, or chalk. Additionally, you may experience restless legs syndrome, a strong urge to move your legs, especially at night, which can disrupt sleep and add to the overall fatigue. Symptoms of anemia. Anemia symptoms often overlap with those of iron deficiency, such as fatigue, weakness, and pale skin, but the specifics can vary depending on the type of anemia. For example, in vitamin B12 deficiency anemia, you might experience neurological symptoms like numbness or tingling in the hands and feet, difficulty walking, or even memory problems. Folate deficiency anemia can also present with similar symptoms, but it might also include a sore tongue or mouth ulcers. In hemolytic anemia, where red blood cells are destroyed faster than they can be produced, you might notice jaundice, or a yellowing of the skin and eyes, along with dark-colored urine due to the breakdown of red blood cells. Chronic disease anemia might not have specific symptoms beyond those of the underlying condition, but it can contribute to a general feeling of malaise, reduced stamina, and an increased susceptibility to infections. Each type of anemia has its unique characteristics, and identifying these symptoms can provide clues as to what might be causing the anemia. How to tell the difference? Distinguishing between iron deficiency and other types of anemia can be challenging because the symptoms can overlap. However, there are a few key indicators to consider. If you're experiencing symptoms like cravings for non-food items, pica, restless legs, or brittle nails, these are more specifically associated with iron deficiency. On the other hand, symptoms like numbness or tingling in the extremities, difficulty walking, or a sore tongue might point towards a vitamin B12 or folate deficiency anemia. Additionally, if you notice signs of jaundice or dark urine, this could indicate hemolytic anemia. A careful assessment of these symptoms, along with a detailed medical history and appropriate blood tests, is essential for distinguishing between these conditions. Remember, an accurate diagnosis is crucial for determining the right treatment, so if you notice these symptoms, it's important to consult with a healthcare professional. When to seek medical help? It's essential to seek medical advice if you're experiencing persistent symptoms like fatigue, shortness of breath, or any other signs that could suggest iron deficiency or anemia. These symptoms should not be ignored, especially if they start to interfere with your daily activities or if you have risk factors such as a chronic illness, heavy menstrual periods, or a diet that may not provide sufficient nutrients. Early diagnosis is key to effective treatment and preventing complications. Diagnostic tests. Diagnosing iron deficiency and anemia typically begins with a series of blood tests. The first step is usually a complete blood count, CBC, which measures different components of your blood, including the number of red blood cells and hemoglobin levels. A low hemoglobin level is often the first indicator of anemia. However, to specifically diagnose iron deficiency, additional tests are needed. These tests include serum ferritin, which measures the stored iron in your body, and transferrin saturation, which indicates how much iron is being transported in your blood. Low levels of serum ferritin and transferrin saturation are indicative of iron deficiency. For other types of anemia, different tests may be required. For example, a vitamin B12 test or folate test can help diagnose anemias caused by deficiencies in these vitamins, while a reticulocyte count measures immature red blood cells and helps determine whether your bone marrow is producing red blood cells properly. Interpreting test results. Understanding your test results can be complex, and it's important to have a healthcare provider interpret them to ensure an accurate diagnosis. Low hemoglobin and ferritin levels, combined with symptoms, typically confirm iron deficiency anemia. If these levels are normal, but you still have symptoms of anemia, your doctor might investigate other causes, such as a vitamin deficiency, chronic disease, or bone marrow disorder. It's also important to note that some test results might suggest multiple deficiencies or conditions happening simultaneously, which is why a comprehensive evaluation is crucial. This step is vital because the type of anemia determines the treatment approach. What works for one kind of anemia may not be effective for another. Consulting with a healthcare provider ensures you get the right tests and understand what your results mean for your health. Treatment for iron deficiency. Once iron deficiency is diagnosed, the primary goal of treatment is to restore normal iron levels and improve the symptoms. This usually involves a combination of dietary changes and iron supplementation. Increasing your intake of iron-rich foods like red meat, poultry, fish, beans, lentils, and fortified cereals is a great start. It's also beneficial to pair these with foods high in vitamin C, such as citrus fruits or bell peppers, to enhance iron absorption. In more severe cases, or when dietary changes are insufficient, doctors may recommend iron supplements. These are typically in the form of ferrous sulfate or ferrous gluconate, which help to replenish iron stores more rapidly. It's important to follow the dosage instructions carefully, as taking too much iron can lead to side effects such as constipation or stomach upset. Treatment for other types of anemia. Treating other types of anemia depends entirely on the underlying cause. For example, if you have vitamin B12 deficiency anemia, the treatment usually involves dietary changes and B12 supplements or injections, especially if the deficiency is severe or due to malabsorption issues. Folate deficiency anemia is treated with folic acid supplements and an increase in foods rich in folate, like leafy greens, nuts, and whole grains. For anemia or chronic disease, the focus is on managing the underlying condition, which might involve medications or therapy specific to diseases like kidney disease or rheumatoid arthritis. Hemolytic anemias, where red blood cells are destroyed faster than they are produced, might require more complex treatments, such as immunosuppressive drugs, blood transfusions, or even a bone marrow transplant in severe cases. Each type of anemia requires a tailored approach to treatment, highlighting the importance of a correct diagnosis. To wrap up, we've discussed the critical differences between iron deficiency and anemia, and why it's so important to understand these distinctions. Iron deficiency occurs when the body lacks enough iron to produce adequate hemoglobin, leading to symptoms like fatigue, weakness, and pale skin. Anemia, on the other hand, is a broader condition that can result from various causes, including iron deficiency, vitamin deficiencies, chronic diseases, and genetic conditions. We also covered how to spot the symptoms, when to seek medical help, the types of diagnostic tests you might need, and the importance of targeted treatment based on the specific type and cause of anemia. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe to the channel for more health-related content and hit the notification bell so you never miss an update. We'd love to hear your thoughts, so feel free to leave a comment below if you have any questions or experiences you'd like to share about iron deficiency or anemia. For more in-depth information on nutrition, managing deficiencies, or understanding different health conditions, check out our related videos in Y channel under the Nutrition and Diet playlist or Vitamin Deficiencies playlist. Remember, taking control of your health starts with knowledge, so continue learning and staying informed. Thank you for watching.